On December 9th, 2021, we had the tragic death of Demaryius Thomas, one of the NFL professional athletes, and it turned out that he suffered from seizures. Likely he had a seizure in the shower that led to his death. Now everyone is asking, can NFL football cause epilepsy? What is the role of concussion in developing epilepsy, and can athletes who have epilepsy continue playing contact sports? Let's discuss all the evidence we have and what the scientific studies showed in this regard. I am Dr. Omar Danoun, an epileptologist and epilepsy specialized neurologist. On this channel, I talk all about epilepsy in an easy way that everyone can understand and still provide a high quality and high value information from the expert. I reviewed all the available scientific studies on this issue of trauma, concussion, and development of epilepsy to answer these specific questions. Traumatic brain injury overall accounts for about 20% of epilepsy cases in the general population. Is concussion a cause of epilepsy? We know that traumatic brain injury, or TBI, can cause epilepsy in 2 to 7% of people, and the more severe the trauma with bleeding and scarring in the brain can cause more irritation to the brain and epilepsy down the line. But this is not our concern here. We are interested in mild TBI or concussion. It is estimated that sports-related concussions account for about 2 million people each year in the United States alone. Earlier studies in 1980s and early 2000s suggested about twofold increase in the risk of epilepsy after mild TBI or concussion, and sixfold increase in patients with family history of epilepsy. If this video is of value to you, please hit the like button so that it can spread to more people. Thank you. However, reviewing these studies, there are multiple limitations such as the accuracy of diagnosis of concussion depending on the hospital records, and may end up including more severe cases of TBI that they will develop epilepsy. We know that many mild TBI or concussions are treated in the sideline or in the doctor's office and not even making it to the hospital. Also, patients with family history of epilepsy, turns out that they have epilepsy tendencies, and concussions only unmask these based on the patient's EEG studies. So, to correct for all of these variables and make sure we answer this question accurately, we need to design newer studies with controlling for all of these factors. There is a recent large study was done in 2018 that tested 330 people with concussion and followed them over 7 years and applied all these diagnostic criteria and controlled very well. The study found no correlation between epilepsy and history of concussion. And in this study, the average number of concussions was about 3.3 concussions per player or per case. So, well, the NFL players will say, well, I get those in one game, yo. There is a study that evaluated concussions in college football players and followed 4,251 players, and 6% of them had concussions, and 1 in every 15 players had another concussion in the same season. Still a relatively large study, but not long enough or large enough to detect this very rare phenomenon that can happen, and it can take years to come. Then came the giant study we all waited for. In 2021, a Danish study evaluated about 2.5 million people and followed them over 40 years of their life, and it turned out that people with mild TBI still have twofold increase in the risk of epilepsy, even years to follow. The risk was higher in patients who had repeated concussions and increased with severity, meaning the worse trauma, the more risk for seizures. So, it seems that mild TBI or concussion might increase the risk for developing epilepsy down the line, and it is slightly higher for people who have more concussions and more repeated trauma, and the worse the concussion, the more likelihood of having epilepsy. But still, we're talking about a rare risk, and it can happen like 1 to 2% of the people who have concussions. Experts think that Demaryius Thomas has epilepsy after his car accident and is not related to his football career. And now the second question about epilepsy and playing sports and contact sports. But to answer this question, let's go out to the biggest stadium in the United States and North America, the Michigan Wolverine Stadium. But it is very, very cold, so I warn you. And the second question is, can people with epilepsy participate in contact sports? Well, the answer to this question changed with time. At the beginning, we took a conservative approach and we limited people with epilepsy from participating in contact sports due to the fear of seizure exacerbation through hyperventilation and changes in medication levels. However, it turns out that with research and new data that exercise actually improved seizure control, improved quality of life, and improved mood. So now it is recommended for people with epilepsy to participate in exercise and sports. Of course, after consulting with your neurologist and following the guidelines, and not participating in very dangerous sports such as scuba diving and free rock climbing. And the other thing is that people with epilepsy have reached all different kinds of sports and participated at professional levels and even won the Super Bowl. And to get the best results, I put together 10 advices for you to follow so that you get the best control of your seizures, and see you in the next one.